Topic is the status of children and youth in the state of Tennessee, and we're talking to the Executive Director of the Commission of Children and Youth in the state of Tennessee, Ms. Linda O'Neal. Of course, Ms. O'Neal, as we promised during the first segment, what we'd like to do now is to give you an opportunity to simply inform our audience of the status of children in the state of Tennessee. I think we see on many occasions various reports dealing with where we rank and et cetera. And so what we'd like to do during the second segment, and perhaps to complete during the third segment, is to talk about the status of children and how bad we are or how good we are and that kind of information.
Sure, I'm always glad to talk about how children are doing in Tennessee. In June of this year, the Annie Casey Foundation released the 2004 Kids Count report, and in that report, they rank all of the states of the District of Columbia, and we ranked 43rd. And what that means is that 42 states are having better outcomes for children than we are in Tennessee. We were also 43rd in 2003, so we're about the same. They're really looking at outcome indicators like low birth weight babies and infant mortality, whether or not children are, the child death rate, the teen death rate, some of those kinds of things. And in the report, we have some good news and some bad news. We're obviously concerned about low birth weight babies and about babies who die in their first year of life. We've made some, we know there's some things we can do to make progress in that. One of the things that's really associated with both of those issues is pregnant women who are smoking. We really need to work on reducing the smoking among all teens and all children and all people, but especially pregnant women, because it's one of the things associated with low birth weight babies. 1 in 4 of the babies who were born at low birth weight in Tennessee were born to mothers who smoked while they were pregnant.
And so that's a very, very important statement, and it's certainly important for young people who are in a childbirth situation to think in terms of the impact, not only that it will have, that smoking has upon them, but it has upon an unborn child. What are some of the impacts that this has upon an unborn child?
Well, the smoking is particularly affects low birth weight babies, which is one of the leading causes of infant mortality. And the smoking is something that we really need to provide assistance to pregnant women so they can stop smoking, and the Department of Health is really interested in that. One of the other indicators, though, in the report that's important is that we've had improvements in the teen birth rate in Tennessee as we've worked together across communities in Tennessee to try to avoid teen pregnancy. We've really had some successes. The teen birth rate in Tennessee now is really at the lowest level it's been in a long time. Still higher than we would like it to be, but we need to really work on reducing that. There's some other things in the report that really show that good public policy makes a difference in positive outcomes for children. We've made substantial improvement in Tennessee in both the child death rate and the teen death rate, and there's some of the reasons that we have made that progress include things like strong seatbelt laws, child restraint devices, bicycle helmet and skateboarding helmet requirements, because the leading cause of death for both children and teens is what they call unintentional injuries, what we all call accidents, and certainly for teenagers, automobile accidents or vehicle accidents are the leading cause of death. And as we've done graduated driver's licensing in Tennessee and really emphasized seat belts, we've seen some reductions in teen deaths in motor vehicle accidents. In fact, in Tennessee, over the past year, there have been several really highly publicized incidences where a number of teens died at the same time in a car, and almost invariably when there was a survivor in that car, it would be the only one who had a seatbelt on. So we can't stress enough the importance of wearing seatbelts and of using child restraint devices.
And so what you're saying here is that public policy can really impact considerably upon what you're doing in dealing with children and youth in the state of Tennessee, that it's not always up to the individual, but the government itself can develop policies that would increase your outcome.
Well, certainly government can develop policies that increase outcomes. Ultimately, though, individuals have to implement those policies, and we really need collaborative efforts that involve not only state and local government, but communities, churches, synagogues, other houses of worship, families and children together to really do better things for children. But one of the best examples of public policy that has really made a difference is TennCare. TennCare has had a very positive impact on children in Tennessee. In Tennessee, we have a lower percentage of children without health insurance than in the nation as a whole, and we have substantially improved the immunization rate of 2-year-olds. We're doing better than the nation as a whole again, and TennCare is largely responsible. It's almost closed the immunization rate gap between children on private insurance and children who are covered by Medicaid or TennCare.
Now, TennCare is faced with a number of problems now, Ms. O'Neal. What can be done in terms of dealing with some of the issues that face TennCare and to make sure that we continue the kind of progress? Because it seems to me that if TennCare has made such an increase and has such a positive impact, we ought to do everything that we possibly can in order to at least try to keep that as a system.
I think we all recognize that TennCare needs to be reformed, but we need to be sure those reforms are carried out in a very thoughtful and deliberative and open process that ensures the changes we make produce not only cost savings but positive changes for health. We know that by better managing the care of particularly individuals who have disabilities or serious diseases, that we can have better outcomes for them. So advocates all across Tennessee are trying to work with the administration, with providers to ensure that as we make changes, we make responsible changes that protect the health of not only children but other Tennesseans who are covered by TennCare. 1 out of every 4 people in Tennessee is covered by TennCare, and almost 1 out of 2, it's about 45% of the children in Tennessee are actually covered by TennCare, and almost half of all TennCare recipients are children.
And so without TennCare, we would really be in a real serious situation.
Without TennCare, we would really have more adverse health outcomes. TennCare has also made a lot of difference in improving prenatal care for pregnant women, and prenatal care is one of those things that can help with low birth weight babies and also reducing infant mortality.
Very good. You know, Ms. O'Neal, when we come back, what I'd like to do is to sort of deal with education. I think that one of the most important elements dealing with education has to do with childhood education, and so quite a bit of information is available in reference to that. And so what we'd like for you to do after we come back with the second commercial break is to give our audience as much information during that time as you possibly can dealing with the different aspects of education. And of course, we'll be back with our audience following this very, very short commercial break. The topic is the status of children